Welcome to Living In. Today we have Dr. Spots joining us again. We're very excited, Dr. Spots, to have you back from Meredith. Thank you.
It's always great to be with you, Amy. Thanks.
Thank you. So today we'd like to talk about bold goals. And what is bold goals?
Well, we've sort of used that campaign, the Bold Goals 2030, to emphasize the parts of what's called the quadruple aim: health, healthcare, joy at work, and also financial affordability for healthcare in general. I'm leading the health part of that quadruple aim, and that's what I'm really going to focus on today. I lead that with my partner, Alan Twigg, who is our Executive Director of Community and Behavioral Health at Meritus. And so I would say that really is focused on the big, bold goal of losing 1 million community pounds by 2030.
We can do this.
I love it.
We can do this as a community.
We're all in this together.
We are. We
Right.
are. And how can people get involved in this project?
So everything that we're doing with this initiative will reflect back on Healthy Washington County. So I would really encourage everyone to regularly go to the Healthy Washington County site and check for the resources in various parts of this campaign as it starts. So we've launched it internally at Meritus as a Healthy Meritus initiative for our own employees to help be leaders in this effort. But this is not all about Meritus. It really is about a Healthy Washington County. And so very soon, you're going to see announced the Go for Bold campaign: do, eat, and believe in a healthy Washington County. And this aligns, Amy, with the 2030 Healthy People Initiative that every 10 years the United States government has done since 1980. So it aligns with initiatives in the nation and in the state. But if you remember, we had over 40 community stakeholders come together with us in January before COVID. It seems like an eternity ago, to talk about what we thought were the major issues facing this community. And we know that diabetes is one of them. And diabetes is also a major issue in the state of Maryland. So Maryland is a little more diabetic and pre-diabetic than many of the other states of the country. And Washington County is not the most diabetic, but it's right up there among the top 10 or 11 of the counties in Maryland. And so when people say to me, why are we focused on this big goal of losing 1 million community pounds? A major issue and a major factor with this is diabetes, trying to, help us get to a more ideal weight, which helps to decrease our chances of getting full-blown diabetes, managing full-blown diabetes better, and also just treating chronic illnesses in general. It reduces our risk for chronic illness.
Absolutely. And that goes back to that theme of eat and believe. And what was the other one?
Do, eat.
Do eat and believe. And really, it's that mindset.
Right.
It's understanding, it's being educated and knowing where your resources are, but really helping yourself, which in turn helps our entire community.
Correct. So do would be being more active. So taking that one step forward, maybe parking a little further away and walking more steps. If you're able, taking the stairway safely compared to an elevator. It doesn't mean, I know it's a challenging time for us as we maybe can't get back to the gym easily, or we don't feel comfortable yet going into those kind of spaces. While we have good weather, can we do things outside? So there'll be lots of partnering with many agencies, organizations, and employers in the county. It'll all kind of come together in that Healthy Washington County website.
Very good. And so as we are working through this, individuals have been home for a long time in many respects, wearing their mask when they're in public, washing their hands, all of those things, but maybe being a little fearful of going to the doctor's office to take care of those chronic conditions. So what's your advice for those individuals today?
Sure. Well, in a broader level, we have, as a part of one of our goals with this, is access to care. So like I said, it's not just about losing weight. That is a long-term goal that helps get us to a much healthier and a better awareness. But we know that access can be an issue in times of the pandemic and times outside of the pandemic. So one of the things we've done at Meritus is we've created the ability that we always want you to check with your own physician and provider's office. But if you are having trouble and you don't feel safe going out and they don't have an ability to do telehealth or a virtual visit, a video visit, we have the capability to do that for the community. We have stood that up during COVID and we plan to continue that forever. We don't want barriers to get in the way of that. So to manage your diabetes better, you may not need to physically come in, but to review your numbers with your healthcare practitioner or your doctor, you may need a video visit and an ability to connect with that. And we've all become much more facile and better about our technology. And if you don't feel comfortable yourself with that technology, you might be able to have a family member help you with that. But we have that ability. So please reach out to Meritus if you can't with your own doctor's office do that. We've really made this be a community effort.
So if they don't have a community physician and they need one, or are just dealing with some things that they're not sure of, can they use telehealth for that as well?
Absolutely. You can actually reach out and we can get you connected with an office and a provider and start that ability as well. But so it's really for anybody who has not had care at all, who maybe just doesn't feel comfortable going back into their care setting at this time. And our goal isn't to take over that care from somebody where they've already had an established relationship. We would help to link them back to that team so that they were getting that team was in the loop and that they would be getting advice from their own team.
Well, we are really excited to be a part of the Bold Goals and moving forward. And we've always been a part of Healthy Washington County, a part of that initial 40 partners at the beginning of Healthy Washington County and the Bold Goals Initiative. And so we're looking forward to the big kickoff in October. More to come on that.
October 6th, we are going to have the ability to have some people with social distancing in the Robinwood Atrium. I think we've had 47 respondents so far, and think of it as a ribbon cutting. We don't have a ribbon to cut, but we have a wall, and we're going to really count on individuals, organizations, and employers to be a part of that pledge to say, here's our best estimate of what we think we're going to do individually or as an organization or as an employer in Washington County to help us get to this goal. If you think about 150,000 residents of Washington County approximately, all of us probably could be 5 to 10 pounds a little healthier on that scale, and that would meet our goal, right? So this is an honor system. This is not a track up and down. It's an accountability factor. Coming for that launch in October 6th, will be a weight tracker that you can get a password that's secure to you. You can get that link on the Healthy Washington County website, and it will not be tracking your individual weight. Somebody's not going to be in the background, saying, Amy, what's your weight today? It's really tracking those cumulative pounds. And so we hope to have downtown and through the chamber, through the health department, through our partners like the Commission on Aging, sort of banners and sort of where are we at? Sort of like when you see the thermometer that rise
right.
To see where you are in that campaign. This is a really big campaign that while this is our kickoff, we know that we'll have some opportunities and events each year to keep the momentum going. If you have a chance to Google Lose 1 Million Community Pounds, Oklahoma City. In 2012, Oklahoma City did this, and you can see with the transformation it had on the community in terms of economic development, overall health, parks and recreation opportunities, and it just had a community really believing in itself. And when all of those stakeholders I just mentioned came together, truly transformative things happened. So do, eat, and believe in a healthy Washington County. I know I can ask the commission to be there.
Absolutely.
Are you in?
We are in. Both of us are in, and we are committed to doing things to improve our own quality of life. The question is, are you in to participate and improve the quality of life, not just for yourself, but for your community and the lives that will replace ours and the next generations that come, setting up tomorrow to be a healthier Washington County?
Please join us.
So thank you for joining us here, and thank you, Dr. Spots, for being with us. As you continue to live in, be safe, wear your mask, social distance, and clean high-touch areas. Until next time, stay safe.